I talked to the task force about women's health and what we have learned about the health, particularly of older women with an intellectual disability, from the longitudinal study IDS Tilda. Well, this is the first time we have women or people with intellectual disability live to old age, and that's really a success story. But what is concerning is that women with an intellectual disability are twice as likely to be multimorbid as men with an intellectual disability, very high levels of joint disease, gastrointestinal disease and eye disease. And very concerning was the oral health status of women with an intellectual disability. And when you compare that to the general population, many women with an intellectual disability who lose their teeth don't have prosthetic dentures. And this is very different to women in the general population. So these are really concerning, and yet women with an intellectual disability visit their dentist more often than women in the general population, but have worse health outcomes. What we would like the Women's Task Force to consider is that the inclusion of women with an intellectual disability is centre stage. And that the issues and the struggles that they have, particularly in terms of accessing health services, being part of the community and being included in policies, etc., are visible. So it really is including, the Women's Task Force needs to include the visibility of women ageing with an intellectual disability.